They make up 95% of the PC, and they're also called adenocarcinomas. The neuroendocrine tumors are less common, and they make up the other 5%, and they form the abnormal growth of hormone-producing cells in our pancreas. It's not really, there's really no cause. It's not really clear about what causes PC, but smoking is linked highly to PC. Some of the symptoms that some people exhibit are jaundice, which is yellowing of the eyes and the skin, unexplained weight loss, diabetes, nausea and vomiting, irregular stool, and itchy skin, and a lot of back pain, a lot of belly pain that leads to the back. The American Cancer Society says that 20 to 30% of PC has, the American Cancer Society has really linked smoking to one of the main risk factors of PC. Being overweight plays a part, and being overweight plays a part of PC, and older age. It says, I put 45, but mostly like higher, like in between 55 to 60 are risk factors. Race and gender, they refer to African Americans and men to have higher chances, and inherited genetics is also a possibility. The best way to develop a treatment plan is to get a good diagnosis. There are several different kinds. You can get an X-ray, an MRI, CT scans are very vital. You can get an ultrasound or a biopsy, and developing a treatment plan for the diagnosis. Okay, treatment. There are several different treatments that you can get when you are diagnosed with PC. There are a few different surgeries. One of them is called the Whipple surgery, where this is the surgery that my mother had, by the way, where you cut the head of the pancreas, the duodenum and the small intestine, the gallbladder, and part of the bile duct. In some cases, and my mom, she had to get her stomach cut as well. Once you have that surgery, they reconnect all the organs where you can continue to have continue to digest. Another surgery is called the distal pancreatectomy. Is the surgery to remove the body and the tail of the pancreas, and then they have a total pancreatectomy is where they remove the entire pancreas out of you. Another treatment plan is chemotherapy, where they use drugs to kill the cancer cells. They can be injected into you by the vein, or you can take it orally. You can receive radiation. You can receive radiation as well with chemo. You can receive one or the other. You can receive both. You can get radiation by itself, and radiation uses high beams made from X-ray and protons to destroy cancer cells. There are also clinical trials which scientists are still coming up with studies and tests to treat this disease. Diane.
Of course, one of the most common signs to early appear is jaundice. Jaundice is yellow coloration of the skin and the mucous membrane. So the first sign for cancer pancreas, cancer head of pancreas, actually all the cancer coming from the head. The majority of cancer coming from the head of the pancreas. this wide head containing the bile duct. So any swelling, any tumor of the pancreas will start to block the bile duct, and once the bile duct is blocked, so the jaundice will start to develop. So a lot of patients, they don't have or they don't pay any more attention, like if they have some colic, if they have like some vomiting or gastrointestinal upset, but the only warning sign, which is like maybe like will be late sign, is the development of jaundice. So jaundice is definitely one of the most character that divert our attention that maybe something wrong with the head of the pancreas. Of course, in recent time, they didn't find any treatment for cancer head of pancreas. And majority of people die from cancer head of pancreas. And we don't have like big studies about if they send metastasis of malignant cells outside the body or not, or to other parts of the body or not. But we are afraid that the cancer start to spread locally. So start from the head of pancreas to spread, as you know that it is attached to the duodenum, so start to spread to the duodenum, and the duodenum is part of the small intestine and make adhesion, and after that invasion of the aortic artery in the abdominal region. Of course, your study is very nice, thank you for your effort, but again, as I told you,